UV disinfection in medical facilities, air and surfaces. A plethora of pathogens. While medical facilities are thought of as centers for healing, both patients and healthcare workers can be at high risk of catching infectious diseases simply by breathing in the air or touching surfaces. This is because of the existence of pathogens, which are ever present in the air and which also tend to thrive on surfaces that are not disinfected properly. Immunodeficient or compromised individuals are more susceptible to these opportunistic pathogens acquired via inhalation or contact or both. These are some of the microorganisms that cause healthcare-associated infections, HAIs, and are also neutralized by UVC light. Influenza, SARS-CoV-2, Candida auris, Staphylococcus epidermis, Clostridium difficile, or C. diff, Staphylococcus aureus, or MRSA, Enterococcus faecalis, Pseudomonas aeruginosa, Serratia marcescens, Mycobacterium tuberculosis, and Legionella. How do these microbes spread infection? Coughing, sneezing, contaminated fluids, and contaminated food all release pathogens such as bacteria, viruses, and fungi into the air or onto surfaces. Exposed human tissue in the context of surgical procedures can also be a source of bacteria. By nature, your hospital or clinic is a dynamic environment subject to a wide range of people. Patients, staff, visitors, contractors, suppliers, administrators, and people from many walks of life roam through hospital wings daily, all of them potential germ carriers. There are many factors that contribute to the indoor air quality, IAQ, of your overall facility or specialized department. Building materials, equipment, furnishings in reception areas, inpatient wards, and administrative offices are all potential sources of bacteria and viruses. Your plumbing, heating, and air handling systems can also harbor and spread pathogens. Means of disinfection. At one time, antibiotics were excellent hindrances to the onslaught of microbial infections in medical facilities. However, because of their overuse, many contaminants have built up a resistance to these antibiotics, which are no longer as effective as they once were. Due to an increase of hospital infections from antibiotic-resistant pathogens since 2019, the CDC rightly issues a call to additional action, including implementing effective infection prevention and control. While free-flowing air circulation is a good start in maintaining a clean and healthy environment, ultraviolet germicidal irradiation, UVGI, has shown to be effective at inactivating over 97% of pathogens, reducing airborne infections in healthcare patients and employees. A 9-hospital study conducted by Duke University and funded by the CDC found that ultraviolet disinfection was effective in decreasing hospital-wide infections. According to the UVGI Handbook, Kowalski 2009, the use of air filtration combined with UV can contribute to providing the near-sterile environment required by AIDS patients. UV disinfection is chemical-free, safe, quick, and easy to maintain. There are several ways germicidal UV can be administered. Keep watching. Ultraviolet technology in healthcare settings can optimize environmental cleanliness, resulting in decreased pathogens that could potentially cause infection. Northwell Health. UV disinfection in ambulances. Sick patients are frequently brought to healthcare facilities in ambulances. FDNY paramedic Nicole Keene reports that EMS vehicles can transport an average of 10 to 20 patients every day, each with a diverse range of symptoms and infections. Since patients typically leave contaminants behind, these vehicles require frequent disinfection. While most EMS staff use bleach and disinfectant wipes to clean their patient compartments after each patient, some fire departments are wisely using UV sanitizers in addition to those methods in their ambulances. Whether mobile models that can be carried in and out, or permanent fixtures mounted on the ceiling, they neutralize pathogens on counters, instruments, walls, stretchers, and floors. Keep watching to learn more about our Sanadyne portable area sanitizers and our Sanilite or Sanaray germicidal UV fixtures. Germicidal UV methods. Upper room UVGI. In occupied spaces, upper room UVGI can be utilized. A fixture, such as Atlantic Ultraviolet's Hygiair, placed on a wall in a public area or hospital room at 7 feet or higher, projects long, uninterrupted ultraviolet rays across the upper room air, neutralizing bacteria and viruses carried by air circulation. In a Russian study cited by the National Institute of Health, upper room UVGI was shown to have the lowest cost per equivalent room air change when compared with 4 other room air cleaners. It was also nearly 10 times more cost-effective than mechanical ventilation in that setting. These models are perfect for occupied rooms such as laboratories, cafeterias, examination rooms, ERs, ORs, and waiting rooms. Field trials conducted in 5 hospitals concluded that upper room UV systems show an average reduction of infections by 70%. The UVGI handbook documents that the New York Central Bronx Hospital chose to install upper room UVGI systems in 1995 to successfully control TB and nosocomial infections. UV Room Air Disinfection. Sanitaire is a model that also addresses airborne microbes in crowded or poorly ventilated areas where the risk of cross-infection is high. These models draw in air through a filter, HEPA available, expose it to UVC rays, and return it to the room with harmful microorganisms neutralized. Since lamps are not visible and UVC rays never exit the chamber, this method is safe for use in occupied areas such as waiting rooms, patient rooms, and operating rooms. Numerous models are available: wall-mounted, ceiling-mounted, and mobile. Use Sanitaire in your occupied rooms, such as ICUs, recovery rooms, laboratories, cafeterias, examination rooms, ERs, waiting rooms, and TB isolation rooms. Two superstars have emerged in the air cleaning world: high-efficiency particulate air filters, and ultraviolet germicidal irradiation systems. Infection control today. Direct UVC for air and surfaces. When hospital areas are empty, a more direct and unhindered application of UV can be made. Our Sanodyne UV sanitizer uses 4 or 8 exposed lamps to inactivate pathogens in the air and on surfaces. By use of a remote control, the power can be turned on or programmed from a safe distance. Because these units have handles or wheels, they can be conveniently moved from one location to another when the lamps have been disengaged. This unit is ideal for locations where permanent sanitizers may not be an option, such as ORs, ICUs, laboratories, exam rooms, morgues, and ERs. Our Sanoray and Sanolite Direct UV models are stationary options for rooms that are unoccupied or where workers are wearing protective gear, such as morgues, labs, and clean rooms. These fixtures can be ceiling mounted and custom wired so that they turn off when anyone enters the area. Independent hospital operating room studies document the success of overhead UV systems at combating infection. UV Air Duct Disinfection. General air quality is an issue in any public building, and medical facilities are no different. In fact, in hospitals, next-level infection prevention is an absolute necessity. Air quality starts with the HVAC system, which controls airflow and air exchange in enclosed interior spaces. The environment within air ducts is a perfect haven for microbes to grow, thrive, and be released into public spaces where they are unsuspectingly inhaled. For this reason, Atlantic Ultraviolet has created the Aerologic Duct Disinfection System, an ultraviolet solution which works specifically within the context of a heating duct. Placement near the condenser coils and/or in the longest duct run is usually recommended for best results, depending on your particular needs. Air passing by the lamps is exposed to UVC rays, damaging the DNA of any pathogens present and rendering them useless. An extensive Canadian study, which analyzed an office ventilation system before and after a UVC air duct system was installed, found a 99% reduction of microbial and endotoxin concentrations. Participants showed a significant reduction in symptoms such as headaches, coughs, congestion, and respiratory issues. Published articles on the ability of UV in-duct air disinfection to reduce microbial contamination in healthcare facilities have demonstrated major reductions in indoor airborne concentrations of pathogens and allergens. Hospital Airborne Infection Control. UV Instrument Disinfection. Surgical instruments must be disinfected in between procedures to avoid risk of infection. Our Sana UV Cube is designed for this purpose, with 4 UVC lamps, removable and washable quartz shelves, and a generously sized stainless steel chamber. Simply set the desired time, engage the power, and watch as the cube safely treats tools and equipment. Use in your labs, clean rooms, operating rooms, morgues, ERs, and pathology departments. Many departments, one solution. Atlantic Ultraviolet Corporation offers these effective ultraviolet disinfection solutions for air and surfaces in the hospital departments and medical facilities listed here. Hospitals, emergency rooms, critical care facilities, TB clinics, methadone clinics, dispensaries, intensive care units, patient rooms, operating rooms, burn centers, isolation rooms, rehab facilities, kidney dialysis, maternity, nurseries, doctor, dentist, and chiropractic offices. We also offer numerous solutions for water disinfection. Visit our e-commerce site at atlanticultraviolet.com for details. Atlantic Ultraviolet Corporation. Contact us today.